Good afternoon, Mr. Gonzalez. How are you?
Pretty good.
Okay, I wanted to see you today because I saw you yesterday, but I wanted to follow up on you and your recent diagnosis with psoriasis and answer any questions that you have. And my staff, we printed some information regarding the disease. You can look it over. You can ask me any questions you have. We'll have more time to follow. So I first wanted to explain to you how do you got psoriasis, or how we can tell you that you got psoriasis. So we as providers, we diagnose psoriasis like you're seeing the distinct rash that you have. It usually happens in both arms, bilateral, and it's a raised lesions that happen. They're very itchy and sometimes they're painful. So the primary way of diagnosing psoriasis, we do it by or assessment or physical assessment in our experience. We're going to send you for a skin biopsy this week. Our staff will give you some information of what you need to do before you go to the appointment. What they're going to do is pretty much take a little sample of your skin with a needle, and they'll look in the microscope to actually confirm the disease, that's psoriasis.
Why did I get psoriasis?
Well, there's two main risk factors why you get psoriasis. Okay. First of all, just to let you know, psoriasis is the most common autoimmune disease in the United States. It is autoimmune. It's considered an autoimmune disease. The first thing is you gotta have some genes. It's pretty much you have a mix of genes that predispose you to get psoriasis. And the second one, you gotta have some triggering factors, meaning people that smoke. I know in your history, it tells me right here that you smoke. We look over your BMI, you're a little bit overweight. So those, and also I know you work, you're a student, so the increase in stress, the smoking, a little bit of inactivity and obesity cause this the rash to appear. And what happens is that these lesions, the skin lesions that you have happens. We know that our skin is the first barrier for bacteria, for any infections that you may get, and also serves a purpose in the part of the immune system. So what happens is the immune system in your skin, there's some cells, so they call T cells. So these T cells start attacking your skin, and what happens is that they cause your skin cells. Usually, in order for them to mature and be a healthy skin, last 28 or 30 days, so they can be healthy and be normal. In case of psoriasis, what happens is that these cells, the skin only lasts 2 to 3 days to develop. They're very immature, very young, and besides that, the skin doesn't get rid of them. Every day we shed skin, and the case of psoriasis, you build them very fast, and then you don't get rid of them. So that's why you build some patches, and it could occur anywhere in your body. That's what happens. That's why you have the redness of your skin is because base of the blood vessels in your skin, they become open and causes more blood flow. So that's why it's red and causes very itching and sometimes pain.
It's contagious?
Contagious. Very good question. No, many people, the appearance of the lesion, especially because you have it in your arms and you have some part of your abdomen, people may think and may look at you different and may see, it's a contagious. No, just so your peace of mind, no, it's not contagious. It's a disease that it is chronic, meaning it's gonna, I want to be very clear, it's gonna happen from here on to the rest of your life. It's sometimes gonna appear when you're more stressed, and something's gonna go away. This may clear up and then come back again. Okay, and just so you know, like the information says, you read it over, you can ask me later on. There's different types of psoriasis. Okay, there's psoriasis that happen in small rashes. Some look like pus. There are many of them. The ones that we're diagnosing you with is plaque psoriasis. Okay, and it's very self-explanatory because it looks like plaques that happens. And right now they're red, but they enraged, and they have a silvery or dry skin scales, the characteristic of the lesions. You have any other questions?
And you mentioned, can this be cured?
Cured. So let's go to the treatment now. So cured, no, it's not cured. It's chronic. Like I mentioned, it's gonna happen in like little episodes. It may happen. You may be okay for months, and then you come back. So cycling, okay. It cannot be cured. This is chronic, but we have there's four main types of treatment. Okay, we could either do topical, which is ointments, creams, or we can do light therapy, which like sun, the UV light specific to the lesions. We could also do tablets or pills, systemic, treated systemic, and we do it according to the symptoms presenting and how much skin is covered. Okay, you're about surface area that's covering your skin is about 10%, so you're in the moderate. It goes by mild or moderate or severe, depending on how much skin is covered. So right now it's moderate. We use topical creams, topical ointments. We start with the mildest type of treatment, so it doesn't create as much symptoms, and then we advance then on, depending how you react. Also, there are some alternative therapies that we call, and they are mainly the main. There's some type of dieting and moisturizing moisture to your skin. You need to keep in mind that there are some other ways you could prevent more symptoms or more rashes. You take a shower every day, keep your skin moist. Do not spend too much time directly in the sunlight. You also, like I mentioned, triggering factors. Smoking. We're gonna give you some information right there about smoking cessation if you're interested in some exercise activities. You can lose some weight. Alcohol, some stressors that cause the rashes to appear more. We want to prevent that so that you can relieve your symptoms. Um, for treatment, we're gonna prescribe you a cream. It's called triamcinolone cream. You're gonna apply this cream twice a day to the lesions. It's an ointment and it's very oily. Okay, so it comes in a very small tube, and if you're not trained or you don't know, you may use the entire tube in one application. The measurement, how we apply it, it will be your fingertip. So if you can use in your fingertip, this is as a type of measurement, and it all depends. Usually for your face, it will be only one fingertip unit of measurement. For the back and your hand, it will also be one. So we'll give you the specific instructions in the paper, just in case you have any questions. And you also may need to be aware of some signs and symptoms, side effects that may happen with this medication. First of all, and the most important one, if you have any allergic reaction, any swelling of your face, of your throat, any severe allergic reactions, call 911 or go to the nearest emergency room. And those are some of the symptoms for allergic reaction. Some of the other symptoms that you may see be very careful with the eyes, the mouth. If you don't have any lesions there, so it's good. Only on the arms. Some other side effects that you may have with this cream is blurred vision, your heartbeat or mood changes. Let us know if you have any of that. Another symptom that you may be experienced by psoriasis, it doesn't only attack your skin, but it also may affect your nails and your joints. It's something called psoriatic arthritis. So you pay attention on the symptoms that you're having. If you notice that your joints are getting swollen, are getting very painful, let us know. We're gonna send the prescription to the pharmacy today, and then you will go get it and you'll start treatment today. We'll follow up in 2 weeks, see how you're feeling, any type of relief, or if it becomes more your rash, you can let us know. If there's any other questions that you have, we have to answer.
No, there you go.
Okay, thank you very much, and we'll be in contact. Thank you.